House Speaker Mike Johnson said today he will not call for a vote on extending enhanced subsidies for people buying insurance through the Affordable Care Act. That effectively guarantees the subsidies will expire at the end of the month, and premiums will spike substantially for some 20 million Americans who get their coverage that way.
So remember how the government shutdown ended, and it ended with this promise, a promise to protect the Affordable Care Act subsidies before December 31st? Well, it seems like that promise is broken. Millions of Americans are about to lose their health care, and there's even a vote going in front of the House to possibly extend these ACA subsidies, but it's bleak. I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So what we're watching unfold right now is exactly what the health policy experts warned about. The government reopened without protecting the healthcare subsidies. And when that happens, coverage doesn't just disappear. It's going to just go away overnight, like the 12/31 to January 1st, it's gone. So it unravels. And this is how it happens. Let's roll this clip.
How the subsidies work. What someone has to spend for an insurance policy is capped at a certain percentage of their income on a sliding scale. So, for example, and there's different plans and deductibles to consider, but generally speaking, let's say I make under $22,000 a year. I'd pay nothing for the basic benchmark health insurance plan. But as my income grows, so does the percentage I'd have to pay, up to 8.5% of my income once I start making $65,000 a year. The remaining cost of that policy, no matter how expensive, is paid for by the federal government. And though they are sometimes referred to as tax credits, in most cases, the money goes straight to insurance companies.
So again, Affordable Care Act, ACA is what you guys know it as, also Obamacare, right? Not the slogans, not the scare tactics, not political theater, but what it actually did. Because for years, Obamacare was treated as a dirty word, if you will, a slur in the policy debates and something that politicians just used to scare voters and believing that healthcare access was a threat, not something good for them. And that framework, actually, it worked for a while, and especially once Trump came in and really threw out that rhetoric, it got worse. And so until the law started working, actually, when millions of people got health insurance for the first time ever, millions of people with pre-existing conditions. So like if you had hypertension or diabetes, you still got health insurance, which previously would be denied. And so now families could actually see a doctor without gambling their financial future. And what was really fascinating, what happened, people started getting better. But now people are working and the name has changed and it's no longer Obamacare, it's the Affordable Care Act. So let's be clear, calling it Obamacare is not a mistake. It's a reminder that nearly 24 million people did enroll today who signed into law and coverage expanded to so many other people that actually got healthcare access possible in this United States. That's supposed to be the best country in the world, right? Dr. Brown?
Yeah, I mean, this isn't ideology, right? This is lived experience. And that's why the moment matters. I mean, we have to really ground this in reality. It became the Affordable Care Act because it was successful. When they weren't sure, it was called Obamacare, right? And before the ACA, being uninsured was normal in America. 14 to 16% of our population had no health insurance. And that wasn't it wasn't a fringe experience. Pre-existing conditions meant denial. That's your asthma, diabetes, hypertension, cancer, pregnancy. Women paid more than men for the same coverage. And getting sick could mean financial collapse, and even for working families. So as physicians, Dr. Sloan and I, we saw this up close. Patients delayed their care. They rationed their medications, including rationing things like insulin, which can be deadly when you have type 2 diabetes. They waited until conditions became emergencies because they had no other option. And that the ACA was designed to really change that reality. And it did that intentionally. It expanded healthcare coverage in 3 major ways. The first, through Medicaid expansion. So states were given the option to cover adults earning up to 138% of the federal poverty level. So that's about $15,600 a year for a single adult in the year of 2025. This single policy choice brought health insurance to millions of low-income Americans, and that disproportionately benefited Black, Brown, disabled, and working class people. Second, the health insurance marketplace. So for the first time, individuals could buy coverage with financial help to reduce the premiums and out-of-pocket costs. And small businesses got their own exchanges too. And third, employer accountability. Large employers were no longer able to say they can't afford coverage, right? They would actually face penalties. And there were protections there for small businesses. And so what happened? As shown by this chart from the State Health Access Data Center, by 2023, the uninsured rate fell to a historic low of 7.9%. So that's not theory, guys, right? That's millions of lives stabilized. So President Obama signed this into law back in March 2010. By 2013, all of the provisions were implemented and insurance coverage grew by 38 million people. 38 million people got healthcare through ACA, and that cut the national uninsured rate nearly in half. I mean, what do you think, Dr. Sloan?
I remember, though, it wasn't just that wasn't the only change. The coverage also sometimes wasn't enough. Remember, in the ACA also rewrote the rules to private insurance. And this is probably what pissed a lot of people off, specifically the big insurance companies. It made it illegal to deny coverage for pre-existing conditions. This was a game changer. It had never been done before, right? And so it banned lifetime and annual coverage caps. Huge. That's where we end up taking on the cost for insurance companies, basically denying some of the things they would normally pay, as well as it capped the out-of-pocket costs for families. These are the deductibles that you have to pay when you go into the doctor's office or go to the emergency room, times that you may not have the money when your child is sick, but you have to pay it to be seen. So it required preventative care. What? How novel? What a novel concept, Cancer screenings, vaccines. Lord, we've been talking about that. Routine checkups, something that could actually catch you, being healthier before something goes bad. Those things were going to be covered with no out-of-pocket costs. It stopped the insurers from being charged higher premiums based on their gender. Dr. Brown just said the women were charged more, as well as their health status. It forced accountability to insurance companies, and insurers raised their premiums too much, then justifiably the public could get mad. They spent too little time and actually on patient care and the issue of rebates. All those things were regulated now, and that was cut out. The middleman was cut out. So it's not abstract regulation. It was on point for the time being, and we thought it was going to continue, right? But it was not just access or protection. It was survival. And the Affordable Care Act didn't fix everything. Yeah, I know it wasn't perfect, but it fundamentally changed healthcare in the United States as we know it. And when people talk about weakening it, taking it away, rolling it back, let's be clear. When people talk about that, it's going to make Americans sick again. Let's roll this clip.
This is now day 41 of this shutdown, the longest in history. Illinois Senator Dick Durbin among the 8 Democrats who joined with Republicans voting in favor of a new spending package. One Republican, Rand Paul, voted against it. The bill does not include an extension of health care subsidies, the key demand from Democrats throughout this shutdown.
So, Dr. Brown, how do we get here? This is what we did. We reached 24 million people on the brink of losing their health insurance, their subsidies, right? And the very support that it takes to get this affordable insurance, we're playing political whack-a-mole, if you will. 11 million people currently pay nothing for coverage, not because it's free, but because the ACA finally worked as designated. I don't know. It didn't just happen by accident, right? It took a lot of work on both sides of the aisle. It happened because during the shutdown negotiations, healthcare was treated as negotiable. Your health, your sickness, your child's health. So 8 Democrats voted to reopen the government without securing protections for ACA subsidies. And one of those was Senator Maggie Hassan from New Hampshire. Dr. Brown, that's closer to where you live.
Yes, that Senator Maggie Hassan, the same senator who on December 17th, 2025, had this to say about these healthcare subsidies. Roll the clip.
It's also important to remember where we were before the Affordable Care Act, where people with pre-existing conditions couldn't get treatment, where people were afraid if they were on Medicaid and they did have benefits, they were afraid to go back to work. So I just think as important as it is for us to drill down on the challenges with the ACA and the things we need to do better, it's important to remember what the world without the ACA looked like, and how devastating that was. Either you couldn't get treatment at all, or you went bankrupt if you did.
Yeah.
Pay attention, everyone.
We didn't get a side. We didn't get a side this week.
No, I know. Here we go. Here's the sigh. So the same senator who was one of the 8 that voted to reopen the government without addressing the healthcare subsidies is now upset that healthcare subsidies weren't addressed as of today. Okay, I'm just checking. So, pay attention. This isn't about confusion. It's not about process, and it's not about both sides. It's about choices. Maggie Hassan and 7 other Senate Democrats reopened the government with the GOP's promise to address this healthcare subsidies cliff. And here we are at the brink of the cliff. Then the people lose here, right? They lose coverage. They have delayed care. They have to ration medication. They end up in the emergency rooms, or even worse. And, right now, healthcare isn't disappearing loudly. It's actually eroding quietly. This isn't a math problem. It is a moral failure. And so I'll ask this question plainly. Dr. Sloan, is America great yet?
Hell no. I mean, we're just like going to hell in a handbasket here with Trump at the helm. And so this is why the moment matters right now, because healthcare policy is never abstract. It shows up in clinics. It's not just in policy and procedures, right? This is real life. This is people's lives on the line. And so we watch all these kids die from not having vaccines. If ACA goes away, guess what? They're probably not going to be able to afford to get the vaccines anyway. So it does matter who shows up in the ER, who's going to live, and who actually dies, you guys. So like she said, pay attention, because this is going to be a game changer. So thank you for watching. Stay informed, stay disruptive, and remember, your voice does matter. We're AIA contributors of MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, follow for more updates. Have a great week.
Thanks, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.